Hello, everyone, and welcome. I'm Dr. Johnson with Alterman and Johnson Family Chiropractors, and you're joining us for Q&A with Doctors A and J. And this series of videos we're bringing to the community to provide resources from professionals and experts in their field that provide services that are in line with what we teach as a chiropractic lifestyle. And so right now I'm sitting with Liz Murphy. Hi, Liz.
Hi.
Thanks for being here and joining us. And Liz has some credentials. She's a massage therapist. She's a personal trainer. I'll let you tell us about yourself. But I'm curious more so about what drew you into practicing in the way that you do, and getting the credentials that you have. What's your story?
Well, like she said, my name is Liz Murphy, and I'm the owner of Active Purpose. We specialize in sports, prenatal, and pediatric massage therapy and training. I started about 16 years ago. I worked for a physical therapist, and I was not credentialed as anything at the time, but I worked for him for a while, and he incorporated massage therapy into everything he did. And I saw the results that he got with his patients, and it was very quick, very thorough. I mean, it was great, what he did. So he actually passed away in 2010, but he was very experienced, had been doing it his whole life. Very, very great mentor to me.
All right. So, Liz, you were going to share with us, I think you called it a compression technique, and we were talking specifically about the hips, the glutes, and I know a lot of our pregnant moms have hip complaints and glutes, and so you have some tips that they can use at home for that.
Yes. So, being pregnant myself right now, I'm going through this too. So I always get a lot of hip glute pain during pregnancy. And then I notice with a lot of my clients, they get that as well when they're pregnant. So having these techniques at home on hand, especially during this shutdown, is really, really important. And so I just wanted to demonstrate how to use something very simple. It's actually just a tennis ball or a racquetball. So I'm going to grab that real quick. So this is the tennis ball. Everybody knows what that is. And this is a racquetball. So the racquetball is smaller, but they both have a little bit of give. So I don't usually recommend using a baseball or softball or anything like that because those are really hard and they won't feel as good. But you do want something that's still pretty firm like these that will kind of get into those adhesions. So I'm going to go ahead and demonstrate that for you if I can get this set up properly. Okay, so I'm going to use the tennis ball because that tends to be my favorite to use, but I'm just going to show in the hips. So in pregnancy, I know I get a lot of pain right through here in that piriformis area out here, and then also in the glute medius and everything like that up here. So I'm going to put it right here, and this is my son.
Wow.
So I stick it right in here, and then I just lay back on it like that. And you can move slightly. So sometimes I'll move my legs around like this. Maybe back and forth. You can also just keep it there for a couple minutes, just until you feel the muscle relax and release around it. And then you can move it to a different spot. But you don't want this to be on bone. So it's important to know your anatomy. It's important to know that the sacrum is right there at the end of the middle of the spine. And then your iliac crest comes up here, but you can feel those. So you can feel those in you, and you want to be right below those and to the side of those. You don't want to be on them. But you'll be able to feel when it's in the right spot because it'll feel tense you'll feel the tenderness and everything, and that's where you want to focus. And if you're able to, you can actually kind of come up on it a little bit with your hands, and you can roll on it a little bit like this. And this allows you to have a little more control over the pressure. So if it's a little too much pressure for you, you can kind of get off of it like this. But if you don't have the strength to do this, that's okay. You can just do the one where you're laying down and then moving your knees like this, back and forth. So it's as simple as that. These can be found at Walmart, Target. You can order them online on Amazon. They're very cheap. They're very easy. Most people have these at home, even if it's their dogs. But I wouldn't recommend using your dogs. But
I was going to say most families that have small children have a variety of different balls, and there's probably one that would meet their needs, right?
Exactly, yes.
So I wanted to just kind of build on one thing that you said and then add one other thing. So really good points about wanting to be on muscle, make sure that you're not on bone, and, just kind of walk that line of knowing what a tight muscle feels like and a muscle that feels like it needs to be worked versus maybe putting it right on the sacroiliac joint where it could just be painful, but you should be able to feel there's soft muscle here or there's not muscle crossing that sacroiliac joint or the base of the sacrum. So really good words of advice there. And then I also, because you mentioned the piriformis, which is down just a little bit lower, but also responds really well to this type of technique. If ever you're doing one of these types of compression techniques and you're feeling radiating pain, then you don't want to do that because you might actually be compressing or irritating a nerve, and nerves don't like that, and you don't want to fire that up. So just walk that line of knowing what feels like a tight muscle that is responding well to that compression. And I love that technique that you shared. That's a really useful and worthwhile technique. And
Thank you.
One of the things that you do, you're a massage therapist, you're also a personal trainer.
Mm-hmm.
And so, people's exercise routines are definitely inhibited right now. Do you have some recommendations for just some general exercise that people could be getting from home?
Yes. Right now, I recommend just anything that has gentle movement, gentle exercise, especially if you are pregnant or not used to exercising. Anything like that, because you don't want to be doing anything right now that is like high intensity interval training or CrossFit type workouts or anything like that if you're not used to them, because there is a propensity for injury. And getting injured right now is not a good idea because there's not a lot of access to help for that. So you would just be suffering, and that's, that would not be a good thing. So I just recommend gentle movement, going for walks. If you're a runner, you can keep running if it's good and healthy for you and your doctor recommends it. And, anything that you're already doing that works and feels good and that you like, continue doing it. But I wouldn't try anything new or intense at this time.
I think that's great advice. So stay active, keep your body moving, be gentle with yourself. Don't try anything crazy and new right now.
Yes.
Put that off until later. I think that's really good advice. All right. Well, Liz, thank you so much. These are really nice tips that you've shared with us. And like I said, we're going to share your contact information with this post so people can reach out if they have questions, if they have, things they want to ask you. And then soon, hopefully, you will all be available for hands-on massage therapy appointments, right?
Yes, I hope so. Hopefully this will end soon.
All right. Well, thanks for taking the time to share with us. I really appreciate it.
You're welcome. No problem.